Welcome to today's Explainer. I'm really glad you're here because today we're tackling something absolutely crucial. We're going to look at exactly how seniors can reclaim their financial independence by putting a stop to overpaying on 5 major reoccurring bills. Based on the deeply researched 2026 Medicare guidelines and the really compelling advocacy of Dr. Clarence Martin, we're uncovering the legal exemptions that millions of older Americans actually qualify for, but, well, they just don't know about. So if you're on a fixed income, or maybe you're helping someone who is, this explainer is going to give you immediate, actionable steps to keep your money exactly where it belongs, right in your pocket.
A quiet tax on your independence. Dr. Martin, a physician who treats seniors every single day, uses this exact phrase to describe what everyday, ordinary bills are doing to his patients. To most of us, a utility bill or a medical premium is just, a fact of life. But Dr. Martin sees a much darker reality. He actually sees his patients skipping essential heart medications or literally turning off their heat in the dead of winter just to make ends meet. It's heartbreaking, really. But it sets a deeply urgent tone because in so many of these cases, these seniors are legally exempt from paying these bills entirely.
Okay, so let's dive into our roadmap for today. First, we'll examine this quiet tax. Second, we'll talk about slashing healthcare costs. Third, cutting living costs. Fourth, reversing unfair penalties. And finally, reclaiming your independence.
All right, part 1, the quiet tax, exposing bureaucratic silos.
Listen, if you're currently overpaying, it is absolutely not your fault. You're dealing with massive bureaucratic silos that just don't advertise their exemptions. They don't talk to each other, and they certainly aren't going to notify you when you can pay less. The crucial takeaway here is that the money is waiting, but it is not automatic. Literally, none of these programs are going to come knocking on your door. And every single month that goes by without you filing an application, well, that's another month you're losing money. Money that really should be funding your health, your family, and your life. You've got to take that first step.
Moving right along to part 2, slashing healthcare costs, premiums, and prescriptions.
Let's tackle 2 massive, direct hits to a fixed income, starting with the dreaded Medicare Part B premium that gets pulled directly right out of your Social Security check. Most people just accept this deduction as an unavoidable fact of life. But actually, there's a federal program called the Medicare Savings Program, or MSP. If you qualify for a specific tier within this program, it's known as QMB, it doesn't just stop that premium deduction, it can actually cover your deductibles and your copayments too. It literally completely eliminates the charge.
To put some numbers to it, under the 2026 guidelines, a single person with a monthly income under roughly $1,350 or a married couple bringing in under $1,824 a month likely qualifies. So if your income falls anywhere under these limits, you need to reach out to your state's Medicaid office or just call 1-800-MEDICARE immediately to get that application started.
Now, let's talk about the pharmacy counter, because there is a massive illusion in our healthcare system. There is a huge, huge difference between being quote-unquote covered by standard Medicare Part D and actually having free or highly subsidized prescriptions. Standard coverage can still leave you with totally crippling out-of-pocket costs. But there's a federal program literally called Extra Help that acts as a strict, hard ceiling for your out-of-pocket medication costs.
$5.10. That's it. If you qualify for the Extra Help program, this is your rigid cap. You will absolutely never pay more than $5.10 for a generic drug, and you'll never pay more than $12.65 for a brand name drug. Think about how life-changing that is for someone who normally pays hundreds a month. This applies if you're a single individual making right around $2,000 a month or less. So, how do you actually get it? Well, the application process is pretty straightforward. You can just apply directly online at ssa.gov. But check out this amazing administrative shortcut. If you successfully applied and got approved for that Medicare Savings Program we just talked about a minute ago, you are usually enrolled in this Extra Help program automatically. Yep, they actually link the two together.
All right, let's transition to part 3, cutting living costs, heating and homes.
So, beyond medical bills, the unavoidable and frankly constantly rising costs of just staying safe and warm in your own home are a massive burden. We've all felt the spike in utility costs, right? Heating is up nearly 9%, and electricity has surged over 12% in some areas. When you're living on a strict budget, these aren't just minor financial inconveniences, they are direct threats to your health. Choosing between buying groceries and keeping the heat on is a choice no senior should ever have to make. But there is a lifeline.
It's called LIHEP, the Low Income Home Energy Assistance Program. And what it does is it makes payments directly to your utility company on your behalf. But what's really interesting here, a detail that isn't widely known, is that in most states, seniors who are 60 and older actually get priority access to these funds.
Now, there is a major catch. You really must dial 211 right away. Why? Well, because LEHAP is not some endless well of money. Once the yearly funding runs out for your state, it's just gone until the next year. Dialing 211 connects you to the National Social Services line, and they'll point you directly to your local office so you can secure your spot before the funds are completely depleted.
Okay, next up in cutting living costs is a big one for the homeowners out there, property taxes. Think about it for a second. Has your county assessor ever sent you a letter offering to lower your taxes just because you turned 65? Absolutely not, right? Local governments rarely volunteer this massive money-saving information. Yet almost every single state offers some form of senior exemption or tax freeze that can literally save you thousands of dollars every single year. But you have to ask for it. And here's exactly how you find it. Grab your computer or your phone and type this exact phrase into a search engine. Your county's name, followed by Senior Property Tax Exemption 2026. That exact search will pull up the specific forms or phone numbers for your local government. It's literally a single action that could safely secure your home and keep thousands of dollars right in your bank account.
Moving on to part 4, reversing penalties, the gotcha surcharge.
So, we really need to expose an unfair bureaucratic penalty that just secretly drains fixed incomes. The formal name for this is the IMRMA surcharge. IMRMA stands for Income-Related Monthly Adjustment Amount. And here is the gotcha part. Medicare looks at your tax returns from 2 years ago to determine your premiums today. So, if you had a one-time income event 2 years ago, maybe like selling a house or drawing down your savings because you just retired, Medicare might be charging you hundreds of extra dollars a month today, based entirely on money you no longer even have. But hey, you don't have to just sit there and take it. The appeal process is incredibly empowering and honestly pretty simple. First, you just identify if you've had a life-changing event, like retiring or the loss of a spouse. Second, file one specific piece of paper, Form SSA 44. Third, you reclaim your money. Dr. Martin notes that people frequently get $300 to $400 a month back just by filing this single form. I mean, it is literally just proving to the government that your income has dropped. That's it. And finally, part 5, reclaiming independence. Financial health is physical health. You know, throughout this explainer, we've talked a lot about forms, websites, dollar amounts, but we really need to tie the mechanics of these financial exemptions directly back to what actually matters, your physical well-being. Because at the end of the day, financial health really is physical health. As Dr. Martin so perfectly puts it, your health isn't just about what happens in my exam room. It's about having the financial peace of mind to live a dignified life. That really captures the core empathetic message of our explainer today. You have a right to live without the crushing stress of these quiet taxes. Taking advantage of these legal exemptions isn't, looking for a handout. It's exercising your rights so you can live with the dignity that you've absolutely earned. If this explainer helped clarify some of these overly complicated systems for you, please hit subscribe so you can stay ahead of the ever-changing 2026 rules. And honestly, more importantly, please share this explainer with a friend, a family member, or a neighbor. Like we said, none of these programs come looking for the people who need them. Your decision to just share this information could permanently and positively change someone's entire financial situation. So, I'm going to leave you with this final thought. Will you leave this money on the table or make the call today? The exemptions are real, the laws are on your side, and the next step is entirely up to you. Thank you so much for joining me today to learn about these vital resources. Take care, stay focused, and I'll catch you in the next explainer.